Welcome to Radio CAHS, presented by CAHS Chief Executive Dr Aresh Anwar. Welcome to Radio CAHS.
Welcome Radio CAHS on Friday the 14th of August 2020. I was just saying actually how anxious I felt prior to each of these shows, even though we've been running quite a few, and Dr Dan was telling me he's a bit more experienced than I am, which made me feel even worse. So can I just start by acknowledging the traditional owners, the Whadjuk people of the proud Noongar Nation, and pay my respects to elders past, present and emerging, and remind us all about our obligations to make sure that we address the needs of the most vulnerable in society, and that's a really important part as children start their journey in life. Can I also remind everyone that we are open to questions on 6456 5629, and can I also ask you please to commit to not making those questions too hard and stretching us on a Friday afternoon. So I'll start with the traditional thank yous. DJ Houston's joined us again, which is fantastic. We have April taking questions, and actually she comes from Radio Loyalty, her dad having previously been in radio, and actually April is also a racing car driver and works with a PR team, and I know that we'll be quizzing her one of these days. Matt Holmes, who has been really reinvigorating the work that we have been doing with consumers, has joined us today. Dr. Dan will provide us with science. Oh my goodness, this is like a really major show today. We have Daniel Staer, who chairs the Youth Advisory Council, and we're really lucky also to be joined today by Neve, who's left work, rushed here, and I think has slightly is overconfident about the professionalism with which we present this show. So, Neve, I have warned you in advance, but thank you for coming to join us. I have got an update on the quiz, which I will give very shortly, because I understand that no one was able to answer the question. I will put the quiz to you, and actually ask whether you could send us a response by email. The sponsor has actually put forward $50 towards a charity of your choice if you get the answer right. So here goes. It will be in black and white on the website. Neve, Daniel, I know you are math superstars, so here it goes. A cyclist with COVID-19 leaves Venice, I don't know whether I should say Victoria, at 2:35 p.m. and travels at 10 kilometers an hour. A second cyclist leaves along the same route at 2:45 p.m. traveling at 16 kilometers an hour. How far do they travel until the first cyclist is at risk of infecting the second one? So that will be up in black and white as we go forward. So I just also normally use this opportunity to provide some updates around what is happening in CAHS. There are a couple of big celebrations that I'd like to actually bring to people's attention. The first is the Children's Hospice, announced for WA in partnership with the Perth Children's Hospital Foundation. That it really represents an enormous commitment by the foundation to caring and supporting children with life-limiting illness, and CAHS will continue to provide the ongoing clinical care, governance and overall management of the facility. And it will provide care for children up to the age of 18 throughout WA who have life-limiting conditions and who really need specialist palliative care. We're expecting that should be able to be used by children and families sometimes towards the end of 2022 or early 2023. I also wanted to highlight the exciting opening and announcement of the launch of the Walyan Respiratory Research Centre this week. It represents what we would like to call a powerhouse partnership between TKI, Perth Children's Hospital Foundation, and Perth Children's Hospital, and it will unite all respiratory-focused projects to drive a new research agenda for childhood lung health. The name was developed in consultation with Telethon Kids Kalunda team and the Aboriginal elders. Walyangyup means place of healthy youngs in Noongar language. It's a 5-year strategy with funding from Telethon Kids and the PCH Foundation. And again, obviously the focus is to ensure that we meet the needs and eradicate the gap that exists in outcome. Can I also just continue to remind the need to put complacency to the side and remain vigilant around how we manage COVID. Of course, the organisation has and feels and is driving its part in ensuring that we are ready to deal with a COVID outbreak. I think it's very sobering to see what is happening in Victoria and also potentially in New South Wales, as well as the reemergence of the disease in Europe. So complacency definitely cannot play a part in the way we take forward, and you'll see that in our globals we highlighted the challenge we would like you to embrace in trying to keep everyone safe. We put forward 8 simple strategies yesterday, including staying at home if you're sick, keeping away 1.5 meters from people where possible, ensuring that you're confident on how to use PPE, ensuring that you are diligent with hand hygiene and hand washing, carrying out simple measures like waiting for the lift when it meets its capacity, taking some leave and making sure that you're really actually refreshed and ready should we meet a challenge where we are and will be expected to deal with a potential significant burden of disease, reducing the duration of face-to-face meetings, and last but not least, ensuring that you cover coughs and sneezes with your inner elbow. I also know that it's easy to stand in a sterile room and suggest and challenge you to potentially prompt others when they fall short. We normally put that under the banner of speaking up for safety. Can I really urge you to do that? Simple acts like that of reminding individuals of their obligation to infection control can easily translate to saving lives. So can I thank you for your enormous commitment to the organisation, but more importantly, your commitment to children, families, and actually your colleagues, and ensuring that we keep them safe. Now, I've probably have rabbited on for long enough. I think we're just about to have a sting.
Call now on 6456 5629 or 0436 595 600 to ask a question.
Dr. Dan, welcome, infectious diseases superhero. And Dan, thanks. If it's okay, what I'm going to do is hand over to you just to ask you just for a general update around maybe the change in COVID profile over the past couple of weeks, and just to share some of your wisdom with us.
Yeah, no, thanks for having us again, Aresh. I mean, I think, as you said, we're all sort of watching what's going on in Victoria, and I'm sure everyone's vaguely aware of what's happening. Obviously, they've entered sort of stage 4 lockdown, sort of very tight restrictions, including a curfew. And sort of a week and a half ago, sort of they were seeing cases up to 600 or 700 a day, and now those numbers have sort of come down, thankfully, to sort of around the 200s and 300s, but still a long way to go, I guess, to see sort of numbers which are controllable, that you can sort of trace all the contacts. So I imagine sort of probably the lockdown's going to go for a number of weeks as yet, and I think they've had particular difficulties in sort of crowded spaces, sort of going back to what you said about trying to limit crowding, particularly sort of in aged care homes, and so I think there's a little way to go, but promising sort of, I guess, turn of events. And I guess the other thing that's come up in the last couple of days, speaking of complacency and trying to avoid that as best possible, is what's happened in New Zealand, that they've had a cluster of community transmission, which I think is up to about 30 cases now. They're not quite sure of the source and how that got introduced, but it just indicates that actually this virus can take us by surprise, and actually if we're sort of maintaining some of those measures, that actually the ability of this to spread is limited, whereas if we ignore everything, then things can get past us very quickly before we realise. So again, I think New Zealand, Auckland's gone down into stage 3 or 4 lockdown, and they're doing their best to sort of trace all these contacts. But I guess just a warning perhaps that although we're doing well at the moment in WA, that we need to be prepared.
And I suppose that is interesting, isn't it, Dan, in the context of community spread occurring, and knowing that even with 0 for over 100 days, you have to remain vigilant. Are there implications for school, or is there any new learnings emerging from schools?
Yeah. Sorry.
No, go for it. You're absolutely right to stop me. I do rabbit on.
No, I thank you. I think you sent me through a couple of articles from the news, and I think there has been a little bit of stuff which is new over the last couple of weeks. I just wanted to touch on a couple of studies that have come out, I guess, probably from South Korea, Israel, and then finally Australia and New South Wales have published their early experience. So I think a particular study which has attracted a lot of attention is from South Korea, and they've got very good centralised sort of public health data. And what researchers have done is that they've looked at all of the cases sort of in different age groups, so 0 to 9-year-olds, 10 to 19, 20 to 29, and so forth. And then they've gone to look at the contact tracing that they've done from those cases to look at, well, how often does a 0 to 9-year-old transmit it to other contacts compared with, say, a 40 to 49-year-old. And actually, one of the, I guess, the headlines from this article, which was published in Emerging Infectious Diseases a couple of weeks ago now, was that 10 to 19-year-olds actually, when they looked at this data, had the highest sort of transmission to people that they were in contact with. I think it was around 18% compared with 10% overall. So I guess what their conclusion was, looking at the data, was that actually sort of your teenagers might be sort of at high risk of transmitting it more so than other people, which is in slight contrast to what we've seen before. The interesting part is that actually another group who are more paediatric minded looked at exactly the same data, and they've published in Archives of Disease in Childhood just as of this week, and they looked at just the children between 0 and 18 years of age, exactly the same children, exactly the same contacts, and they came out with an attack rate of 0.5%, which is probably more in keeping with what we've known before. And actually the measures that they've had that they outlined in these papers was that if a child was unwell and they needed to go home to be cared for, that the parents were wearing masks, gloves and gowns, doing hand hygiene, distancing where possible. So a transmission rate of 0.5% is probably more in keeping with that. And I think the difference was that they looked at the data slightly differently, in that the first study that reported the really high rates, actually some of the secondary cases had the same exposure. So it was families who had gone to a church and everyone in the family got exposed, but they sort of deemed that the other family members had been infected by the 10 to 19-year-old, and I think that's where the difference comes from. So I think the study got a lot of attention, but I think actually probably looking at the data in a second way, it's hard to interpret too much from it. So I think just wanted to, I guess, address that because it has been in the news a little bit. But then moving on to Israel, what we do know is that in high schools that you can have outbreaks occurring. And I think also we referred to a couple of weeks ago what's happened in Melbourne at one of the secondary schools, that there's been a large cluster of cases. And we know that teenagers, particularly older teenagers, are susceptible to getting infections, probably different from the children under 10 years of age, and that actually that you can get big outbreaks in schools. And what happened in Israel when they reopened schools after closing for a couple of months is that they saw a big cluster in one of the schools following a heat wave. And this was in a school where they had class sizes of up to 40 children in sort of very tightly packed classrooms. You imagine on a 40-degree day, no one's going to be wanting to wear masks, and the air conditioning was on continuously, or the windows were closed. And what happened is that probably a couple of people introduced the virus into the school while they were feeling unwell, again talking about trying to stay home when you're unwell, and then sort of they didn't quite identify them until about a week or two later, and by the time they got to that point, about 15% of the children and staff were testing positive. So actually, again, probably a warning that these things can happen within schools, and not to scare, I guess, our listeners, but definitely sort of a warning that children aren't immune to this. They may be slightly less susceptible, but that's probably more the younger children, and that sort of we need to be vigilant. And I guess just to round that off, I guess with a positive note, is that sort of in New South Wales, they had very close contact tracing in the first wave, and they've just published that data in detail. And essentially they had about 27 cases that went into schools or childcare centres when they were infected. That was around 15 staff and 12 students, and they traced about 1,500 contacts, including sort of testing about half of those, even if they were asymptomatic. And they found that actually sort of only 1% of the contacts around actually developed sort of infection. And sort of they were able to control that by closing down the schools, isolating all the contacts. And I think when you've got manageable numbers, actually that strategy will allow you to open schools when you've got limited community transmission. So there's been a bit come out about schools. I think probably the bottom line is that if you've got widespread community transmission, it becomes harder to control, and schools can be one of the settings where outbreaks can occur, particularly high schools. But if we've got low community transmission and we respect those basic sort of principles of hand hygiene, keeping distance, staying home when you're unwell, like you should be doing everywhere else, that actually with good contact tracing and sort of contact isolation, we can probably aim to keep schools open even with sort of low rates of community transmission.
Dan, that's fantastic. When you were talking about caring for children at home, it, I suppose, provoked some of the really challenging information that's bubbling up out of Victoria, and that is, if we are to care for children and families, then we need to protect staff, yet the numbers of healthcare workers who appear to have active COVID infections in Victoria seems to be not insignificant, I think well over 1,000. And I just wondered whether there were any lessons that had emerged from Victoria that we really need to embrace with rapidity. I did talk about some of those 8 actions we'd like staff to embrace, but are there any other lessons that we need to take on?
So I think it is quite worrying what's happening in Victoria, in that, as you say, Aresh, the healthcare workers represent a large portion, and those numbers sort of appear to be growing. Hopefully, I think they've stabilised of late, but definitely as a proportion, healthcare workers have represented a higher number of cases compared to the general public, and we're not really sure how that's occurring. And I think there's been a lot of, I guess, talk about it, but no hard data as yet. What we do know from, I guess, our colleagues in infectious diseases over there is that there's probably several ways that healthcare workers are becoming infected, sort of through the community initially, but then also sort of in the workplace. And I think sort of it's not just sort of patient to patient, sort of patient to staff sort of transmission. And I think this is anecdotal, but sort of I think we do know that sort of when there's been contact tracing within certain hospitals, that they've identified that staff to staff transmission is actually a really important factor in this. And that's not to point the finger at staff. I think everyone over there is exhausted. They're all working very hard. But actually sort of congregating in tea rooms where you're just relaxing to have a break, if you've got large numbers of people there, then it's probably not a good idea if there's community transmission. And the risk may be more from your pre-symptomatic or asymptomatic colleague than it is from the child where you're actually wearing PPE, which we know sort of works to prevent infection.
Dan, thanks very much. I will, if you're okay, take a break now. Remind everyone that they could call in to ask questions on 6456 5629 or text your questions, please, to 0436 595 600. Both very memorable numbers and easy to jot down quickly. Thank you, Dan.
Welcome to Radio CAHS, presented by CAHS Chief Executive Dr Aresh Anwar. Welcome to Radio CAHS.
Brilliant. Now, this is our chance to talk to our Youth Advisory Council. Daniel, thanks very much for coming in. Neve, thanks very much for coming in. I feel anxious asking you questions because I know you're much more used to social media and communication than I am. I normally sit in an office, look at Excel spreadsheets.
I don't think I'm much better than you.
So we're super excited. Can I just start by asking each of you, just give us a bit about a background about yourself. Daniel, can I start with you? Are you studying? Tell us a bit about yourself.
So I'm studying at Curtin University, studying accountancy, and just recently this semester picked up a couple of units wanting to study programming. So been enjoying that and struggling a bit with the workload, but enjoying it.
Well, you're always smiling. And Neve, what about yourself? You said you were working when you came in. Tell us a bit about yourself.
Yes, so I graduated last year and I decided to take a gap year this year, so I've just been working. I'm actually working on getting my swimming qualification to teach children, so that's been pretty fun.
Fantastic. And Neve, tell me how you first got involved in the Youth Advisory Council.
I've always been very interested in health. I come from a health family. And I first heard about the Youth Advisory Council when my friend got admitted to hospital. She was here for quite a lengthy stay. She broke her pelvis. So I came in, I was in here a lot with her, and I heard about the Youth Advisory Council, and that was something I thought I'd be interested in, and that's how I got involved.
That's brilliant. And Daniel, yourself, because you've been chairing the committee for how long now?
About 2 years, a bit over.
Just could you just maybe tell us all just how you got involved initially?
So initially I managed to fracture my hip when I was 15, and because of that had a couple of operations to try and fix the issue. Meant I stayed in hospital for a little while then. But my cousin, who was involved with the Consumer Advisory Council at the time, actually said to me, "Hey, would you be interested in joining the Youth Advisory Council and trying to share your experiences there?"
I mean, I love meetings. I spend my entire day in meetings, which my son asked me about how many boring meetings I've been to. I just wondered what the council does, because it's not just about meetings, is it? What's the purpose of the council?
I mean, a big thing for us is wanting to represent, or at least voice, a couple of the experiences of people who have gone through the health service, and so we're wanting, we've tried to get a good range of people to do that, and yeah, we're also wanting to engage with the rest of the consumer, with the rest of people who are experiencing the health service now, and actually be able to voice a bit of their experiences as well.
And Neve, do you mind if I ask you, what do you think the major challenges are for us, which the council sort of sees as priorities at the moment? Because we obviously have a very health-centred perspective from it. I'd just be really fascinated to hear how you saw the challenges emerging.
Yes, of course. At the moment, one of our major challenges is actually awareness, so getting youth to understand that we're here for them. Recently, we have just done a massive planning meeting on how we can communicate better with our youth who are in our services at the moment. One of them being we're trying to get a bit of social media going, as that's a platform which lots of people are on at the moment, but also getting out in the community, giving events, getting a bit more interaction with our consumers at the moment, yeah.
I'm going to sound like an old fuddy-duddy. Tell me what social media means these days. Is it Facebook or is it more than that? Is it TikTok?
I suppose there's lots of different platforms on social media. I'm not really sure what direction we're going with it, but there was a bit of talk about Instagram. That's one that lots of young people are using these days. Not so much Facebook, from what I...
You can be rude.
Yeah, from what I know, It's a bit more old Facebook for old people.
Yeah.
So we're looking a bit more at Instagram at the moment. Yeah.
And Daniel, you mentioned it when you were talking about your studies that you were doing programming. I mean, is the use of technology, do you think, a big key or doorway into interacting with children these days, or actually is it a bit overhyped?
Well, I think there's a range to it. I mean, when you, from a young age, you're carrying a phone with you, and so technology is in your pocket quite a bit, and a lot of kids are picking up social media at the moment as well. So I think there is the ability to access that. I think there's also trying to do it in a way that will be engaging and will be fun, because that's something that it can be a bit. You can do something in a way that could be a bit cringy, or you can try and actually challenge them and let them have fun with it. And I think there's that challenge for us as well.
I mean, one of the interesting things, isn't it, where and I've heard the age ranges categorized in so many different ways. So the challenge around children and then adolescents or young people. Mm-hmm. And I just wondered how much we managed to capture the challenges that children face in the health service as opposed to adolescents and young people. And the Youth Advisory Council, do you have a lower age limit as to where the group that you feel you're representing best, and is there a gap that you think we need to fill?
At the moment, our lower age bracket is at 13, so it is quite a bit older.
Yeah.
I would like to see, I'm going a bit off script here, but I would like to see a way to communicate a bit more with younger kids. Yeah. But, a meeting setting that we've had, we don't feel would work so well for them, so we're trying to figure out how we can engage with them in that space.
Neve, you any feedback on that yourself?
Yeah,
Thoughts?
so our lowest person on the committee, her age is 13.
Yeah.
But I do feel that representation comes from the other the other advisory council with the parents.
Yeah.
Obviously, parents are advocating for their children when they're 10 below-ish.
Yeah.
So I feel that our communication with younger children comes mostly from parents and guardians. Yeah.
And this week I think we celebrated International Youth Day. And Youth Advisory Council obviously plays a key role in bringing the voice of youth. We've just talked about that age group that you best represent. I mean, and I note that you are really taking on a lot of responsibility, which is fantastic, around how you engage with youth. What do you think we need to do as a health service to make ourselves more youth-centric? I mean, is it the way that people interact and chat to children and families? Is it the way that we've configured our buildings? I mean, what do we need to do? Where do you think our responsibility lies?
I think a part of it is the communication between doctors to kids. And don't know about the experience so much now, but in my experience, it was kind of, I left it to my parents, and I did kind of regret that in some ways, because I just kind of didn't care for it and didn't take ownership of my own health in that way. So I think if we can kind of bring it to the kids, have them understand it as well, and understand that this is their lives, this health issue is something that's going to impact, you know, their dreams for the future, but also just challenge them in that to, you know, think a bit further, think about how they're going to take care of themselves, their bodies in that. I think that's a key part to it.
What did your parents think of that, can I ask?
Think of what do you mean?
Just in terms of the balance between them feeling a responsibility about looking after you and you wanting to take responsibility yourself.
I think Mum did have to was a bit frustrated with me, to be totally honest with you, because it was sometimes just towing me to the hospital and towing me back again, you know, being a bit of a lazy teenager that I was at the time. So, yeah, I don't know how else they felt about it. Haven't asked them too much about that.
And what about you, Neve? Because you've been looking at it through the prism of a friend you described as having been unwell. I mean, do you debate this with your parents and your friends, or what is the audiences in which you promote and discuss the issues?
Well, I'm very fortunate I haven't been in hospital myself, so I can't really speak from any experience, but something that we are working on as a council is really making sure that the communication between health professionals and consumers, children, is something that they can understand, something child-friendly. I know lots of work that we do is changing words so children can understand them and really comprehend what's happening. Mm-hmm. We're definitely very focused on engaging children with their own health care and taking ownership of it and understanding that they can do this and helping them in the future progress into adult services, so it's not such of a shock, oh my gosh, I didn't realise that I had to do this and that and I don't understand what this word means. Yeah, making words more child-friendly in how we communicate with younger consumers.
Now look, that's such an important thing, because this show goes out mainly to staff. I mean, of course, as staff members, we're also parents, and I hope can see it through several different eyes. When you started this journey, Neve, did you set yourself an ambition as to, when you finish your time with the Youth Advisory Council, I will think it will have been a success if I had achieved A, B or C? Were you that clear in your thinking, or did you actually come with a desire just to see what the challenges are and then evolve your thoughts?
Yeah, I didn't really have a particular goal when I started, but I assume that we all have one goal, and that's to make the health services for children the best they can possibly be, the most positive they can be, the most enjoyable and safe they can be. And I feel that the Youth Advisory Council, Daniel and I, and we're all working towards that, and I think we have made some great steps towards that, towards a change to make it the best that health can be.
Very well put, Neve, and I absolutely agree. You have made some enormous strides. It's fantastic. Daniel, can I, as chair, ask you a similar question? When you started as chair, had you set some clear goals in your mind, or again, was the portfolio too large and you thought it would be lots of little things that would make it a success?
I think you've answered it there with a lot of little things that would make it a success. One goal that we're still striving for is to be able to get back into the community and talk with people on wards, also out in community settings, the kids that are experiencing community health, mental health, and just kind of hear what their point of view is of what they're experiencing at the moment. That's been something that has been more so a focus of mine more recently. But coming into it, yeah, I think similarly, kind of just that mindset of I want to make this health service as comfortable as, you know, I can do in my own helping way to actually for the youth that are coming in after me.
So Daniel, just being the person who at school was the very last person to ever be picked to be part of a team, you know, when you stand in a queue hoping that you won't be the very last person, but being that very last person, you touched on remaining healthy. And I wondered, again, I suppose in our advisory councils, we have focused very much on, quite rightly, because it needs a focus, on children who have been unwell. Do you think there is a room for the hospital and the youth advisory council to start promoting good health in children who have been fortunate enough not to be touched by illness? So prevention, COVID has really focused the mind around wellness, and we know that early intervention has very long-term impact on outcomes. And do you think we need to think a bit more about how we use youth in maintaining health, as opposed to, in addition to advocating for those who find themselves unwell?
I think that's a worthwhile cause. I mean, you know, each person has so much potential to help the society around them, and you know, each person has dreams and things that they want to do, and you know, if people are unhealthy, that might hinder them from what they can do or what they want to do, and so I think that's that's just physically, mentally as well. I think that's just a huge thing to be able to help people be motivated to actually live as best as they can and to do what they can to help others.
Brilliant, thank you. Neve, what about you? Your thoughts about staying healthy and our role in using children to promote health in other children and youth to promote youth in others?
Yeah, of course, I agree with Daniel. Recently, actually, in one of our meetings, we've been talking about vulnerable children, vulnerable people in our society, and that's from what we define that. It's not just people who are unwell, but people who maybe don't know how to access the health system or don't have the education to...
Social vulnerability?
Yeah. So that doesn't mean that they are unwell per se, but maybe if they became unwell, or if their friend needed help, or if they were needed to help someone they knew come into the health system, then how would they do that, and how can we communicate to these people or these vulnerable people and show them how they can do that if maybe they don't have the support around them, or the parents helping them to say, oh, you need to go to the dentist every 6 months, or oh, you need a regular checkup at your doctor to make sure that you're still healthy. Yeah.
So Neve, that's good, because it aligns completely, and we've not shown you because it's secret squirrel material, and that is our strategic priorities, and our strategic priorities are going to focus on vulnerable children. So the fact that there's alignment around the issues that are discussed in the Youth Advisory Council, and actually what we're discussing as a management team, is absolutely fantastic. So you're absolutely spot on. Thank you for highlighting that and reminding me of that we really mustn't forget that cohort whenever we speak and have the opportunity to promote. Now, look, I want to do two things. One is to thank you both. I can see why you are leading the Youth Advisory Council. You very, very articulately put forward the challenge. As always, with all good leaders, you have been terribly self-effacing for the enormous contribution that you make. Taking time out today is just an example of that. And also for your fellow Youth Advisory Council members, can I ask you please to pass on our enormous gratitude to them? But I am not allowed to let you go without asking you a question. We have been documenting a number of personal habits, for want of a better word, in this, and that is whether you would be keen enough to share your favourite biscuit with us. So, Dan, I can't remember what yours was. You refused to name a biscuit, did you?
Tim Tam.
Tim Tam. Dan was Tim Tams. Neve, I know I've caught you on the hop.
Oh, yes, you definitely have.
Well, I'm going to give you a minute to think, but you can't leave the studio without telling us your favourite biscuit. I eat all biscuits, so I got out of the answering it. Daniel, the Youth Advisory Council and biscuits. I was told no good meeting was important enough not to be stopped for a biscuit. Give us your favourite one.
Oh, there's so many to choose, but I think I'd have to go for, I don't know the name of it, biscuit with a bit of lemon in between and like salt on the sides. Lemon finger.
Oh, well, we got... Anna, do you know the name of it, or it's a legitimate biscuit, is it?
Lemon
that sounds
finger.
horribly unhealthy for you. Salt and biscuit. Oh, my goodness.
Just pick on my preferences there, why don't you?
And Neve, have you landed on one?
Yes, I have. I think my favourite is just the classic chocolate digestive.
Oh, yes. Actually, do you know what? You do remind me. I was a chocolate hobnob. So actually,
no,
we've got...
I'm not about a hobnob, no.
No? Oh, my goodness.
They're
we
a
got
bit
close
too
on
grainy
it.
for me.
Well, look, on that, I'm going to thank you for the time you've given up, as I said earlier, and also the time you dedicate regularly to children, families, vulnerable children, and CAHS as a whole. Thank you very, very much.
Thank
Tremendous
you.
job.
Thank you.
Call now on 6456 5629 or 0436 595 600 to ask a question.
We might get some questions. April, welcome. Thank you. Look, April, just before we go, I know you've got some questions. Just tell us a bit about yourself, because I know you are a racing car driver. So have you got a race this weekend?
I do.
Oh,
the
wow.
weather's not looking too good, so if
So
we
what-
can
tell us
not
just a
rain
bit-
dance, that would be nice.
And so will you race no matter what the weather?
Oh, I think there's obviously some limit. If there's, lightning around and things like that, they quite often will call the race. But, yeah, a bit of wet weather never hurt anyone.
And for someone who hasn't got a social event planned for this weekend, where can they come and see you race?
Wanneroo Raceway,
And what kind of car do you
Barbagallo.
race?
I race a Formula V, so it is an open wheeler for those that are into circuit racing. So it's similar to a Formula One without the budget. So I don't need a massive wallet, which is always nice.
Oh, well, that's fantastic. Well, congratulations to you, and thank you,
Thank you,
for
Aresh.
bringing the diversity to our workforce and team. So are there any questions that we've had?
There are. I just wanted to give everyone an update, though, on the quiz question, most of all. We've had a couple of people send through some answers.
Oh, have we?
And I just wanted to give our listeners, an update on where we're at. We've had a couple of answers with 4,444 metres, and we had one of 4.5. And I just wanted to confirm that they are incorrect.
They are incorrect. Oh,
So, the quiz...
You're going to devastate someone's weekend.
Yeah, happy Friday. But I suppose, the good thing for our listeners is that you still have the chance to be the quiz master. So keep sending in those answers. That's really good.
So the winner will get $50 donated towards their charity.
Correct.
And they will get the opportunity to set the next Radio CAHS quiz. Is that right?
Correct. Yes. So if you want to continue to send through your suggestion for the correct answer, you can do so on the text line, and we will continue that going until we get a correct answer.
That's fantastic.
Wonderful.
And you said, were there some questions as well?
I do. Dr. Dan, I might ask you to jump in on this one and feel free to help out. But we had a question around if you can give some clarity on the guidance for space per person for meetings. So the Australian government guidelines is currently saying 4 square metres per person, but WA Health is 2 metres squared per person, so which is correct?
Yeah, so it is sort of slightly confusing, but I think because of the state that we're in WA and sort of being stage 4 of recovery, which I guess is different from stage 4 lockdown in Victoria, sort of the higher the number, I guess the better. That sort of we've decided, I guess at a state level to sort of go with a 2 metre squared restriction, which is sort of what we're following here at PCH.
Perfect. I have a couple of others. Aresh and Dr Dan, in the Department of Health COVID webinar on Wednesday, there was some discussion about working from home. The Director General's view was that WA Health is leading by example in terms of this, and how well do you think CAHS is prepared for working from home option for staff should we have another outbreak?
Okay. Look, just a couple of things. I think being prepared is not a final state, and I suppose that is what complacency is about. So we have been continuously reviewing all our systems and processes. This was a question that bubbled up very early on in Radio CAHS, and my response at that time is the same response I'm about to give now. That is, we spent a lot of time making sure that our policies and procedures were clear, fair, transparent, and could be very easily explained. We secondly backed that up with an acknowledgement that much of the work that's done is done face-to-face contact, looking after children and families, and that had to be done at the workplace. Where that could be done elsewhere, I believe we have carried out a risk stratification process and provided individuals with the necessary tools to be able to work from home. We are about to revisit that to make sure that we capture any change in circumstance and make sure that each and every individual has the opportunity to be personally assessed around the fitness or the need to work in the workplace, as opposed to being able to do their job from home. So I believe we are ready. I believe we have systems and processes in place, and I believe we are just about to revisit that to make sure that all our information is up to date. So yes, I feel comfortable, but I don't feel complacent, and know that there's continuous work to be done to improve and make sure that we are learning the lessons from elsewhere.
Wonderful. And one final question is around events and an annual training course, which is due to come up soon in October, and the course is set to run for an all-day period. So do the current guidelines around room capacity apply, room space apply in these situations?
Dr. Dan was really clear that there is a difference between recovery and restriction, and we have seen how situations in cities and states changes very, very rapidly. So I think maybe New Zealand this week has been the most explicit example of that. So at the moment, everyone needs to follow the room capacity limits, which are based on the size of 2 meters squared rule. And I suppose the other issue is around making sure where possible people are meeting and trying to adhere to meetings being less than 2 hours. But we understand that in a setting where there is no community transmission, you may make a decision that based on risk to benefit, the benefit of having an education session warrants bringing people together whilst adhering to the 2 meter squared rule, and we would support that. What I would ask you to do is to make sure you have a plan B and a plan C. That is, if you arrive in October having had a large body of staff or colleagues committed to a training day, please make sure that you are able to facilitate the day through means other than face-to-face, so as not to lose the advantage of all the work that's done in the preamble to the date at which the course is due. So yes, I would support education, ongoing education. We really don't know how the challenges COVID is going to last, and we need to make sure that people remain up to date and their intellectual curiosity is met. But please, please don't become complacent and presume that we will be sitting in exactly the same situation in October as we are now. Plan B is really critical.
Wonderful. And not so much a question, but more of an update from one of our long-term listeners. Just messaged in to give us some clarity around the biscuit. It's called a lemon crisp.
Oh my goodness.
So for those biscuit enthusiasts, we have an answer on the lemon crisp.
And it's interesting actually, because we've heard from everyone but Matt Holmes, who stood very silently. Matt, as leader of the consumer engagement work, you cannot get away without sharing your biscuit story with us.
Oh, it's got to be the mint slice. Nothing beats the slice.
Oh, good Lord. I don't know what that is. I'm going to have to take a list and spend my weekends experimenting. Anna Wood, who is a member of our press team, has also is very despondent and is a believer in the, what crisp?
Lemon crisp.
Crisp.
It's not her favourite.
Not her favourite. Okay.
Melting moment. from the back stalls, she's shouting out a melting moment.
Oh, is she? Okay. Oh, April, you're all heart, actually. And DJ Houston, I'm going to draw the show to a close, but give us your favourite biscuit as a preamble into the weekend.
My favourite biscuit was always the Monte Carlo.
Ah, yeah, I think you're a really you like city names, don't you? So we will, with that, bring the show to an end. Thank you for all the hard work and contribution you make each and every day in CAHS to looking after children and families, and I wish you a very happy weekend. And for those of you who aren't going to get a break, thank you very much for the work that you do. Have a great time. Once again, thanks to Radio Lollipop and DJ Houston for giving up their time and supporting this. Thank you.
Welcome to Radio CAHS, presented by CAHS Chief Executive Dr Aresh Anwar. Welcome to